A 3.5-year-old Medicare Advantage collaborative care pilot between health insurer Aetna and Portland, Maine-based independent physician practice NovaHealth has shown significant care improvement and cost savings for the 750 patients enrolled in the program. According to NovaHealth officials, a division of multi-specialty healthcare provider Intermed, technology and health plan support plays a large part in launching a successful collaborative care initiative.
Intermed had already installed an electronic health record 2 years before this pilot project began. So we had a resource in the electronic health record already in place. You can't do this without an electronic health record. That's critical. Second thing that I think we may even talk about a little as we go along here is that the data exchange between the health plan and the provider group is critical. There's a lot of data that the health plan has that we need access to, and we can provide information to the health plan that there's no way they can get access to except through our ability to mine the data in the electronic health record that we have. And then for most groups, some kind of support from the health plan to allow the group to staff up to hire the people that need to be hired to do the analysis of the patient's records and to monitor all these patients to be sure that they're getting the kind of care that they're getting as a population. It's proactive care as opposed to reactive care.
According to Libby Collette, NovaHealth's executive director, both Aetna and NovaHealth have built on existing technology to continuously improve how they share patient data.
The technology both on our side and with Aetna evolved over time. So originally we did struggle with challenges of how to find out or how to make certain that we knew about patients that were in different inpatient facilities, and we're now using a web-based portal that Aetna has developed to communicate that information. The other thing that was helpful was as Aetna developed its information technology capabilities around this new model, they allowed us to self-report data. So whether it was from the registry or the electronic medical record, we could report on patients that they weren't familiar with, de-identified, aggregate data on quality measures until we had systems up where Aetna could validate or report from their system. So it was a really collaborative approach as both organizations moved forward on the technology front. And the technology piece can't be understated. It is the backbone to putting together a collaboration.
But NovaHealth managers say leveraging data and technology is only part of the recipe for success. It is how they are used by the care teams that really makes the difference.
One caution I would make is that as you invest in technology, whether it's a registry, an electronic health record, or a practice-based care management system, the technology has to support the care team. It can't be the other way, and I think some large organizations have wonderful investments in technology, but it doesn't fit in the workflow, the process, the redesign. So finding technology partners who will help develop tools that support the relationship between the physician care team, and the patient is crucially important.
While maintaining the trust of the patient is important, fostering trust among providers and health plans as they co-manage these programs goes a long way to ensuring their success.
Like any relationship, it takes time. It takes some level of trust and confidence building in the early stages. We have regularly scheduled phone calls with our care teams, our care managers, Dr. Claffey and staff from Nova and Intermed, with representatives from Aetna, and that includes not just the typical, maybe not even so much the contract people with the health plan, but their care management team and their medical directors. And on cases like this, a lot of that trust building starts doctor to doctor.
This trust between payers and providers also underscores a new realization.
The savings can be substantial. Health plans and the provider groups have slowly come to the realization that they need each other. That the idea of functionally negotiating on price and trying to get the cheapest dollar for the whatever the service is doesn't fundamentally alter the way care is delivered and does not lead to overall lowering of cost.